This is Disease Breakdown, where I take up a disease and give you a quick breakdown of its classifications, pathogenesis, and clinical presentations. And this week's disease is
By definition, osteoporosis is a reduction in bone mass leading to bone fragility. The word itself is of Greek origin and literally means porous bones. Osteoporosis has two main classifications, primary and secondary. Primary osteoporosis is due to normal human aging, whereas secondary is caused by other clinical disorders. There are two types of primary osteoporosis, senile and postmenopausal. Senile osteoporosis is due to human aging. With age, the body's ability for bone formation via osteoblasts reduces, whereas the ability for bone resorption via osteoclasts stays the same. Furthermore, growth factors in the extracellular matrix also diminish. A big determinant of how detrimental senile osteoporosis is going to be to a particular individual is the person's peak bone mass. Higher the peak bone mass, the longer it takes for the onset of osteoporosis. Peak bone mass is dependent on various genetic, nutritional, and environmental factors, and usually peaks during early adulthood, some may near the 30s. Postmenopausal osteoporosis only affects female patients and is primarily due to the reduced estrogen levels post-menopause. This results in higher rates of osteoporosis-related fractures in postmenopausal women compared to men of a similar age, with almost 50% of the women suffering from osteoporotic fractures compared to 2 to 3% of men. Secondary osteoporosis, on the other hand, could be due to various reasons, such as endocrine or GIT disorders. Certain drugs can also affect bone formation and therefore cause osteoporosis. Alcohol intake and smoking can also have a negative effect on bone formations. Other causes for the disease include anemia, osteogenesis imperfecta, pulmonary disease, as well as many other conditions. As discussed earlier, the disease could manifest itself with age, and that is the predominant reason for osteoporosis. However, other factors could also lead to the development of the disease. Increased physical activity correlates with higher bone density, as exertion of mechanical force on bones stimulates bone remodeling. Therefore, reduced physical activity of particular bones can result in osteoporosis. This is also important in the case of astronauts who need to exercise for hours daily since they live in a zero-gravity environment. Interestingly, the magnitude of the mechanical force seems to be more important than the number of times the force is exerted. Therefore, to maximize bone mass, one should practice more resistance training than endurance. Calcium nutrition also affects osteoporosis. Lower calcium intake would result in lower bone formation. Fascinatingly, this is a prevalent problem with adolescent girls but not boys, which does have detrimental effects for the girls, as it leads to the early onset of the disease. Osteoporosis could also develop due to genetic factors, such as abnormal vitamin D receptors or reduced calcium uptake. And of course, secondary causes, namely prolonged glucocorticoid use, smoking, and alcohol, could also cause osteoporosis. Diagnosis of osteoporosis is difficult since it is usually asymptomatic until fractures occur. Fractures commonly present in the femoral neck or spine and can cause further complications such as reduced height or kyphoscoliosis in the case of thoracic and lumbar fractures. In the case of femoral neck fractures, complications can include pneumonia and pulmonary embolisms. Even though differentials for osteoporosis might be difficult, there are methods to investigate the condition with dual energy absorptiometry and quantitative computer tomography. A point to note about investigations of osteoporosis is that plain radiographs and serum calcium and magnesium levels aren't good identifiers, as they're insensitive methods of measurement. Management of osteoporosis can be done by a few methods. In terms of prevention, increased calcium diet as well as regular exercise to increase peak bone mass would be helpful. Vitamin D and calcium supplements can be used for both primary as well as secondary care, particularly for elderly patients. Pharmacological treatments are also available, such as anti-resorptive and osteoanabolic agents, which can delay the effects of osteoporosis. A common osteoanabolic is parathyroid hormone, which increases osteoblast activity.
that was the disease breakdown of osteoporosis. Did I miss anything out? Was there something you would like to know more about? And what disease would you like to know more about in the next video? comment down below. If you liked this video, be sure to hit the like button, and if you didn't, hit the dislike button. And of course, subscribe to my channel if you wanted to see more of this content.